Muscles of the anterior compartment of thigh. These are the muscles of anterior compartment of thigh. The first muscle is Sartorius. Then comes the Quadratus Femoris, in which there are 4 muscles: the Rectus Femoris, the Vastus Lateralis, the Vastus Medialis, and the Vastus Intermedius. The last muscle is Articularis genu. This is the Sartorius muscle. The origin of the Sartorius muscle is from anterior superior iliac spine. Insertion is in upper part of the medial surface of the shaft of tibia. The nerve supply of all the muscles of the anterior compartment of thigh is femoral nerve. The action of the Sartorius muscle is abduction and lateral rotation of thigh, flexion of leg at the knee joint. Rectus femoris. This muscle is bipinnate and deep fibrous straight. The origin of the straight head is from anterior inferior iliac spine. The origin of the reflected head is from the groove above the margin of the acetabulum and the capsule of the hip joint. The insertion of the rectus femoris is in the base of patella, as you can see over here. The nerve supply of all the muscles of the anterior compartment of thigh is supplied by femoral nerve. The action of rectus femoris muscle is extension of the knee joint and flexion of the hip joint. Vastus lateralis. This is the vastus lateralis muscle. This muscle forms the large part of the quadriceps femoris. The origin of this muscle is from the upper part of the intertrochanteric line. The insertion is in lateral surface of the base of patella, as you can see over here. The nerve supply is femoral nerve again, and action of this muscle is extension of the knee joint. Vastus medialis. This muscle is vastus medialis. Origin of this muscle is from lower part of the intertrochanteric line. Insertion is in base of patella in the medial border, as you can see over here. The nerve supply is femoral nerve again. Action of this muscle is again extension of the knee joint. Vastus intermedius. The origin of this muscle is from the shaft of femur. The insertion is in base of patella again. The nerve supply is femoral nerve again, and the action of this muscle is extension of the knee joint. Articularis genu. This is the muscle. Origin is from the anterior surface of the femur, and insertion is in suprapatellar bursa or synovial membrane of the knee joint. The nerve supply is again femoral nerve. Action is to pull the synovial membrane upward during the extension of the knee. Muscles of the medial compartment of thigh. These are the muscles of the medial compartment of thigh. First muscle is Adductor Longus. This is the muscle, this triangular muscle. This is a triangular muscle forming the medial part of the floor of the femoral triangle. The origin of this muscle is from the body of the pubis in angle between pubic crest and pubic symphysis. Here this is the pubic crest and this is the pubic symphysis. Insertion of this muscle is in the middle 1/3 of the shaft of femur. All the muscles of the medial compartment of thigh is supplied by obturator nerve. The action of the adductor longus is to adduct the thigh. Second muscle is adductor brevis. This is the muscle. This muscle lies behind adductor longus and the pectineus muscle. Origin of this muscle is from anterior surface of the body of the pubis. From here, insertion is in line extending from lesser trochanter to upper part of the linea aspera. Here is the lesser trochanter. So insertion is over here. Nerve supply is again obturator nerve. Action is again adduction of the thigh. Adductor magnus. This is the muscle you can see over here. This muscle is the largest muscle of this compartment. Because of its double nerve supply, it is called as hybrid muscle. The origin of this muscle is from the ramus of ischium. Here is the ramus of ischium. The insertion of this muscle is in linea aspera. Nerve supply of adductor magnus. Adductor part is supplied by the posterior division of obturator nerve. Hamstring part is supplied by tibial part of sciatic nerve. Action of this muscle. Adductor part causes adduction of the thigh. Hamstring part helps in the extension of hip and the flexion of knee. Hallucis, this is the muscle. The origin of this muscle is from inferior ramus of pubis. The insertion is in upper part of the medial surface of the tibia. The nerve supply is again obturator nerve. Action is flexion and medial rotation of thigh. Pectineus, this is the muscle. Pectineus is a flat quadrilateral muscle. It forms the part of the floor of the femoral triangle. Origin of this muscle is from the ramus of the pubis. Insertion is in the line extending from lesser trochanter, here is the lesser trochanter, to the linea aspera. Nerve supply is double nerve supply. Anterior fiber is supplied by femoral nerve and the posterior fiber is supplied by anterior division of obturator nerve. The action of this muscle is flexion of the thigh and adduction of the thigh. Now we will be seeing the muscles of the gluteal region. This is the gluteal region. The first muscle of the gluteal region is Gluteus Maximus, which is not seen in this diagram. Gluteus Maximus, this is the large quadrilateral powerful muscle covering mainly the posterior surface of the pelvis. This whole region is covered by Gluteus Maximus. Origin of this muscle is the posterior gluteal line. The origin of this muscle is from here. Insertion. Deep fibers are inserted into the gluteal tuberosity, as you can see over here. The great part of this muscle is inserted into iliotibial tract, as you can see over here. Nerve supply of the Gluteus Maximus is inferior gluteal nerve. The root value is L5, S1, S2. The action of this muscle is the extension of the thigh, lateral rotation of the thigh, abduction of the thigh. It is a fan shape and covers the lateral surface of the pelvis and hip. Origin is from the gluteal surface of the ilium between the anterior and posterior gluteal line. The insertion is into the greater trochanter of femur over here. The nerve supply is superior gluteal nerve. The root value is L4, L5 and S1. The action of this muscle is abduction of thigh, medial rotation. Gluteus minimus, this is the muscle. The origin of this muscle is from the gluteal surface of the ilium between the anterior and inferior gluteal line. Insertion is into the greater trochanter again. The nerve supply is a superior gluteal nerve and the root value is L4, L5, S1. The action is abduction of thigh and medial rotation of thigh. Piriformis, this is the muscle. It lies below and parallel to the posterior of the gluteus medius. This is the gluteus medius. It lies over here. Origin is from the upper part of the greater sciatic notch. From here, you can see over here also. Insertion is into the greater trochanter of femur. Nerve supply is ventral rami of S1 and S2. Action is lateral rotation of thigh at the hip joint. Gemellus superior. This is the muscle, as you can see over here. Here also you can see. It is also a fan shape and it is a flattened belly, lies in the pelvis. Origin is from the pelvic surface of the obturator membrane over here. Insertion is in the medial surface of the greater trochanter of the femur. The nerve supply is nerve to the obturator internus. Root value is L5, S1 and S2. The action of this muscle is lateral rotation of thigh at the hip joint. Quadratus Femoris. As you can see over here, this is the muscle Quadratus Femoris. It is a quadrilateral muscle lying between the inferior gemellus and adductor magnus. Origin is from the upper part of the border of the ischial tuberosity from here. Insertion is in quadrate tubercle and the area below it. The nerve supply is now to Quadratus Femoris. Root value is L4, L5, S1. Action is the lateral rotation of thigh at the hip joint. Obturator Externas. As you can see over here, this is the whole muscle, Obturator Externas. It is a triangular in shape, covers the outer surface of the anterior wall of the pelvis. Origin is from the outer surface of the obturator membrane, outer surface of the bony margin of the obturator foramen. Insertion is into the trochanteric fossa. Nerve supply is posterior division of obturator nerve. The root value is L2, L3 and L4. Action is lateral rotation of thigh at the hip joint. Tensor fascia lata, which is over here, you can see. This muscle lies between the gluteal region and the front of the thigh. The origin of this muscle is from the outer lip of the iliac crest up to the tubercle of the iliac crest. Insertion of this muscle is in iliotibial tract 3 to 5 cm below the greater trochanter. Here is the greater trochanter. So this muscle is inserted below the greater trochanter 3 to 5 cm. Nerve supply is the superior gluteal nerve. Root value is L4, L5 and S1. The action of this muscle is adduction and medial rotation of thigh and extension of the knee joint. Gemellus inferior. This is the small muscle and it lies below the obturator internus. Here is the obturator internus muscle and here is the gemellus inferior. The origin of this muscle is from lower part of the lesser sciatic notch. From here, insertion is in medial surface of the greater trochanter of femur. The nerve supply is nerve to Quadratus Femoris. Root value is L4, L5 and S1. The action of this muscle is lateral rotation of thigh at the hip joint. Obturator internus. This whole muscle is obturator internus. It is a fan-shaped, flattened belly, lies in the pelvis and the tendon in the gluteal region. Origin is from the pelvic surface. Insertion is in the medial surface of the greater trochanter of femur. Nerve supply is nerve to obturator internus. Root value is L5, S1 and S2. Action of this muscle is lateral rotation of thigh at the hip joint. Muscles of the back of thigh. This muscle is also called as hamstring muscle. Semitendinosus. It is named so because on the upper part it has muscular belly and in the lower part it has a long tendon for the insertion. Origin of this muscle is from ischial tuberosity. The insertion of this muscle is in the medial surface of the shaft of tibia. This is tibia. The nerve supply is tibial part of sciatic nerve and the root value is L5, S1 and S2. The action of this muscle is flexion of knee and medial rotation of leg. Semimembranosus. It is named because it has a flat tendon of origin, which is not seen in this diagram. It lies deep to semitendinosus. As you can see over here, this is semitendinosus and this is semimembranosus. Origin of this muscle is also from the upper part of ischial tuberosity. And insertion is in posterior surface of the medial condyle of tibia. The nerve supply is tibial part of sciatic nerve. Root value is L5, S1 and S2. Action of this muscle is flexion of knee and medial rotation. Biceps femoris. This is the long head of biceps femoris and this is the short head of biceps femoris. Long head arises from the ischial tuberosity, upper part of the ischial tuberosity. The short head arises from the linea aspera. The insertion of both the head is in the head of fibula in front of its apex over here. The nerve supply, long head by tibial part of sciatic nerve and the short head by common peroneal nerve. and the root value of both is L5, S1 and S2. Action of this muscle is flexion of knee and lateral rotation. Adductor magnus, this is the muscle. This we had already seen in the medial compartment of thigh. Muscles of the anterior compartment of the leg and the dorsum of the foot. These are the muscles of the anterior compartment of the leg. The first muscle is tibialis anterior. It is a spindle-shaped belly with multipinnate fibers. The origin of this muscle is from lateral condyle of tibia, from here. Insertion is in the base of the first metatarsal bone over here. Now supply is deep peroneal nerve. Action is dorsiflexion of foot and inversion of the foot. Extensor hallucis longus, this is the muscle. The origin of this muscle is from medial surface of the shaft of fibula, from here. Insertion is in dorsal surface of the base of the distal phalanx of the big toe, over here. Now supply is deep peroneal nerve. Action is dorsiflexion of foot and extension of metatarsophalangeal and interphalangeal joint of the big toe. Extensor digitorum longus, this is the muscle. The origin of this muscle is from the lateral condyle of the tibia, from here. Insertion is in the base and the distal phalanx. Now supply is deep peroneal nerve. Action is dorsiflexion of foot, extension of the metatarsophalangeal and proximal distal interphalangeal joint of 2 to 5 toes. Now we will be seeing extensor digitorum brevis. This is the muscle. It is a small muscle situated on the lateral part of the dorsum of the foot. This is the dorsum of the foot. Origin of this muscle is from the anterior part of the superior surface of the calcaneum. This is the calcaneum bone. The origin is from here. Insertion is in the phalanx. Now supply is deep peroneal nerve. Action is extension of the metatarsophalangeal joint at big toe. The peroneal muscle. These are the peroneal muscle. The first muscle is Peroneus longus, then Peroneus brevis, and then Peroneus tertius. The Peroneus longus, it lies superficial to Peroneus brevis. This is the Peroneus brevis muscle. It lies superficial to it. The origin is from the head of the fibula. Insertion is in the lateral side of the base of first metatarsal bone. The nerve supply is superior peroneal nerve. Action is eversion of foot, especially when the foot is off the ground. Peroneus brevis muscle. It lies deep to Peroneus longus. The origin is again from the lateral head of the shaft of fibula. Insertion is in lateral side of the base of the fifth metatarsal bone. This is the fifth metatarsal bone. This is first metatarsal bone, this is second, this is third, fourth and fifth. The nerve supply is superficial peroneal nerve. Action is eversion of foot. Peroneus tertius. This is the muscle, Peroneus tertius. The origin of this muscle is from lower 1/4 of the medial surface of the shaft of fibula. The insertion is in medial part of the dorsal surface of the base of the fifth metatarsal bone. Nerve supply is deep peroneal nerve. Action is dorsiflexion of foot and eversion of foot. Superficial muscle of the back of the leg. These are the superficial muscle, the gastrocnemius muscle, the plantaris muscle, and the soleus muscle. Gastrocnemius muscle. This is large powerful muscle. It has two heads, the lateral head and the medial head. This is the medial head and this is the lateral head. The medial head is larger than the lateral head. The origin of the medial head is from the capsule of the knee joint. The origin of the lateral head is from the lateral condyle of the femur, and the insertion is in the medial 1/3 of the posterior surface of the calcaneum over here. The nerve supply is tibial nerve. Root value is S1 and S2. Action is strong plantar flexion. Now the soleus muscle. This is the soleus muscle. It is a sole-shaped multipinnate muscle which lies deep to gastrocnemius. This is the gastrocnemius muscle. Over here it will be the whole gastrocnemius muscle and it lies deep to it. The origin of the soleus muscle is from the tibia and fibula. The insertion is in the calcaneal tendon over here. The nerve supply is tibial nerve. Root value is S1 and S2. The action is against strong plantar flexion. Now the plantaris muscle. This is the plantaris muscle. It is a vestigial in human beings. It has this short belly and a long tendon. The origin of this muscle is from the line of the femur at oblique popliteal ligament. It is inserted into the posterior surface of the calcaneum. The nerve supply is tibial nerve. Root value is S1 and S2. Action is the transplantation of its tendon. Deep muscles of the posterior compartment of leg. First muscle is popliteus. This is the muscle. Origin is from the lateral surface of the lateral condyle of the femur. Insertion is in the posterior surface of the shaft of tibia above the soleal line. The nerve supply is tibial nerve. Action is unlocking the knee joint by the lateral rotation of femur on the tibia prior to flexion. Flexor digitorum longus. This is the muscle. The origin is from the upper two-thirds of the medial part of the posterior surface of tibia below the soleal line. The insertion is in the base of the distal phalanx of lateral foretoe. The muscle ends in a tendon which divides into four, one for each of the lateral toes. Nerve supply is tibial nerve. Action is plantar flexion of ankle joint, and it also supports the medial and lateral longitudinal arches of foot. Flexor hallucis longus. This is the muscle. Origin of this muscle is from lower 3/4 of the posterior surface of the fibula and interosseous membrane. Insertion is in the plantar surface of the base of the distal phalanx of big toe. The nerve supply is tibial nerve. Action is plantar flexion of the ankle joint, and it also supports the medial longitudinal arch of foot. Tibialis posterior. This is the muscle. The origin of this muscle is from upper two-thirds of the lateral part of the posterior surface of the tibia below the soleal line. Insertion is in the tuberosity of the navicular bone and the other tarsal bones except the talus. The nerve supply is tibial nerve. The action is the plantar flexion of ankle joint, inversion of foot at subtalar joint, and it also supports the medial longitudinal arch of foot. Muscles of the first layer of the sole. These are the muscle. Flexor digitorum brevis. The first muscle. This is the flexor digitorum brevis. This muscle lies deep to the plantar aponeurosis. The origin of this muscle is from the medial tubercle of the calcaneum from here. Insertion muscle ends in the four tendon for the lateral four toes. These are the tendons. This 1, 2, 3, 4 tendons. The nerve supply is medial plantar nerve. Action is flexion of the toes. Adductor hallucis. This is the muscle. This muscle lies along the medial border of the foot. Origin is from the medial tubercle of the calcaneum. This is the calcaneum bone. Insertion. The tendon fuses with the medial portion of the tendon of the flexor hallucis brevis. The nerve supply is medial plantar nerve. Action is the abduction of the great toe away from the second toe. Abductor digitorum. This is the muscle. This muscle lies along the lateral border of the foot. Origin is from medial and lateral tubercle of the calcaneum from here. Insertion. The tendon fuses with the tendon of the flexor digitorum brevis. Nerve supply is lateral plantar nerve. Action is abduction of the little toe. The muscles of the second layer of the sole. These are the muscles. Flexor digitorum longus. This is the tendon of this muscle. The origin of this muscle is from upper two-thirds of the medial part of the posterior surface of the tibia below the soleal line. This muscle divides into the four tendons, each inserted in the plantar surface of the distal phalanx of the second to fifth toes. Nerve supply is tibial nerve. Action is plantar flexion of the lateral four toes and plantar flexion of the ankle. Flexor digitorum accessorius. Origin. Medial head is large and fleshy. It arises from the medial concave surface of the calcaneum. Lateral head is small and tendinous. It arises from the calcaneum in front of the lateral tubercle. Insertion. The muscle fibers are inserted into the lateral side of the tendon of the flexor digitorum longus. Nerve supply is lateral plantar nerve. Action is flexion of the toes through the long tendon. Lumbricals, these are the muscles. There are 4 of them, the first, second, third and fourth from medial to the lateral side. First lumbrical is unipinnate and the others are bipinnate. The first lumbrical arises from the medial side of the first tendon of the flexor digitorum longus from here. Second lumbrical arises from adjacent side of the first and second tendons of the flexor digitorum longus from here. The third lumbrical arises from the adjacent side of the second and the third tendons of the flexor digitorum longus from here. The fourth lumbrical arises from the adjacent side of the third and the fourth tendons of the flexor digitorum longus from here. Insertion. Their tendon passes forward and medial side of the metatarsophalangeal joint. This is the metatarsophalangeal joint of the lateral 4 toes and dorsally for insertion into the extensor expansion. Nerve supply. The first muscle by the medial plantar nerve, the other 3 by the deep branch of the lateral plantar nerve. Action. They maintain extension of the digits at the interphalangeal joint flexor hallucis longus. This is the tendon of flexor hallucis longus. The origin is from lower 3/4 of the posterior surface of the fibula. Insertion is in the great toe. Nerve supply is tibial nerve. Action is plantar flexion of the big toe and plantar flexion of ankle joint. Muscles of the third layer of the sole. These are the muscles. The first muscle is flexor hallucis brevis. This muscle covers the plantar surface of the first metatarsal bone. This is the first metatarsal bone. It is a Y-shaped tendon as you can see. The origin of this muscle. This is the lateral lip and this is the medial lip. The lateral lip arises from the medial part of the plantar surface of cubital bone. The medial part, this is the medial part. It is the continuation of the tendon of the tibialis posterior into the foot. Insertion. The muscle splits into medial and lateral limb. The muscle is inserted into the base of the proximal phalanx of the great toe. This is the great toe. Nerve supply is medial plantar nerve. Action is the flexion of the proximal phalanx at the metatarsophalangeal joint of the great toe. Adductor hallucis. This is the muscle. This is the oblique head of the adductor hallucis and this is the transverse head of adductor hallucis. The oblique head arises from the second, third and the fourth metatarsophalangeal joint. The transverse head is small and arises from the deep metatarsal ligament. The insertion is on the lateral side of the base of the proximal phalanx of the big toe over here. Nerve supply is deep branch of the lateral plantar nerve. Action is the adduction of the greater toe towards the second toe and it also maintains the transverse arches of the foot. Flexor digitorum. This is the muscle. It lies along the 5th metatarsal bone. This is the 5th metatarsal bone. Origin is from the base of the 5th metatarsal bone. Insertion is into the lateral side of the base of the proximal phalanx of the little toe over here. The nerve supply is superficial branch of the lateral plantar nerve. Action is the flexion of the proximal phalanx at the metatarsophalangeal joint of the little toe. Muscles of the 4th layer of the sole. These are the muscles. The plantar interossei is a 3 belly which is unipinnate. It is a slender muscle belly. Tendon passes on the medial side of 3rd, 4th and 5th metatarsal. Origin is from the base of the medial side of the 3rd, 4th and 5th metatarsal. Insertion is in the lateral side of the base of the proximal phalanx of the 3rd, 4th and 5th toe. Nerve supply is lateral plantar nerve. Action is abduction of 3rd, 4th and 5th toes and flexion of metatarsophalangeal and also the extension of the interphalangeal joints of the 3rd, 4th and 5th toes. Dorsal interossei. These are the muscles. It has 4 bellies and these are bipinnate and fills the gap between the metatarsals. Origin is from the metatarsal bones. Insertion is in the base of the proximal phalanx and the distal and dorsal digital expansion of the toes. First muscle is inserted on the medial side of the second toe, second on the lateral side of the second toe, third on the lateral side of the third toe, and fourth on the lateral side of the fourth toe. Nerve supply is lateral plantar nerve. Action is abduction of the toes tibialis posterior. This muscle is not seen in this diagram. Origin is from the posterior surface of the leg bone. Insertion is into the tuberosity of the navicular bone. Nerve supply is tibial nerve. Action is plantar flexion of ankle.